Hello, everybody. I'm Bob Griffin. I'm the Dean of the College of Emergency Preparedness, Homeland Security, and Cybersecurity here at the University at Albany. On behalf of President Rodriguez and Provost Kim, I'd like to welcome you to tonight's town hall. We are fortunate enough to have the Provost sitting in on tonight's session, and she will be part of the team answering questions and answers. As always, if you have questions now or questions at any point during the presentation, please just put it into the Q&A section, which is right at the bottom of your Zoom bar. We have a special show tonight. Again, we're going to have some international guests on talking about the approach from Sweden, and I'll introduce them in a second. Before I do, though, a couple of quick messages. First is I would be remiss if I didn't recognize the person who's really put these town halls together, and that's Matt Tyler. And congratulations, Matt, on your graduation. You've done a tremendous job with these town halls. I also need to call out the UAlbany esports team, who right now are actually participating in the Chancellor's Cup quarterfinals, and we wish them well. They're doing remarkably well. My co-host, Dean David Holtgrave, actually is on CNN in just, I think within just the hour. If you haven't heard the news, Dean Holtgrave and members of our own School of Public Health published today in the Journal of the American Medical Association, and they published an article called "The Association of Treatment with Hydroxychloroquine and azithromycin with in-hospital mortality in patients with COVID-19 in New York State," which is an absolutely enormous accomplishment. And on behalf of the CEHC family, I just want to thank everybody over at the School of Public Health, and particularly Dean Holtgrave with what he's doing. This work is so important. And, you know, it really shows the power that UAlbany is bringing to deal with this international problem. So if you get an opportunity after we're done and you've asked great questions, turn on CNN and watch our own Dean Holtgrave on. He's just amazing. Final note, this is our last town hall for this session. If I don't know what the summer is going to bring, and if we start to do town halls up, what we're going to do is that we will post it on both the CEHC Facebook, and School of Public Health will also put it on their social media platforms, including Facebook. So do me a favor, just check in on a regular basis and put the alerts on, and we certainly would love to continue this great process. Now, it's my pleasure, and I'm moving a little bit quickly because Dr. Stern is going to explain to you the importance of our guests, and also what time it is in their willingness to stay up late for us. So I'd like to turn the session over to Dr. Eric Stern from CEHC to introduce our guests. Dr. Stern?
Happy to do that. For those of you who don't know me, I'm a professor of political science at CEHC. And video. There we go. Before I came to UAlbany, I spent 25 years of my life doing research and working and living in Sweden. Sweden is my home away from home. When the organizers of the town hall asked if perhaps we could get some Swedish guests to talk about the somewhat different path that Sweden has taken in this event, I thought that was a fantastic idea. We can learn from each other, and it also a very good follow-up to the guests from China that we had on a previous event. So we have two different kinds of presentations for you tonight. One of them is we have a pre-recorded message from Anders Tegnell. Anders Tegnell is the Anthony Fauci of Sweden, you could say. He is the face of the public health response to COVID-19. He is has a title called the State Epidemiologist. We don't have anything that quite corresponds to that. And our other guests will tell us a little bit more about the Swedish context and the system. But Anders Tegnell is really the captain of the ship for the Swedish public health response. We caught him on the train on his way home. We did it about a 20-minute interview with him today. We had some technical difficulties, and only about half of the audio was usable. So there's some topics that we covered that you won't get to hear, but there's about 10 minutes of good video that we're going to play. Anders would have liked to have been with us live, but it is it's actually past 1 o'clock in the morning in Sweden, and so he was not able to participate in light of his other duties. And so we wanted to see if we could find a complimentary speaker who could be with us live, and who would be willing to do it. And so I thought, who does their best work after midnight? And then I thought of Dr. Fredrik Bynander, who is a famous Swedish night owl, a crisis management expert. He is the director of the Center for Societal Security at the Swedish Defense University. He also used to direct the strategic analysis section at the Cabinet Office Crisis Management Cell, and is currently supporting the COVID-19 response. He has a PhD in political science from the prestigious Uppsala University, and it is just generally a fantastic guy. For the DRC folks here, the disaster folks, one reason that I know that he does good work after midnight is I remember an evening many years ago where he sat up with Russell Dines till about 4 in the morning and bonded with him at a conference. And so I'm sure he's going to do good work for us now. I'm not going to say anything else. Matt, perhaps you could cut to the Anders Tegnell tape, and then Fredrik will help us to fill in the gaps.
The pandemic in Sweden started slightly already in the end of February with the first case of a woman coming back from China. But that case never gave any secondary spread or was easily handled by the local community disease officer. So we didn't think too much about that. But then in the middle of February, it's the big spring vacation in Sweden. And then we already saw some trends out in Europe that there might be cases, especially in Italy. It was very clear that cases were coming on. We were trying to assess the situation and wondering if we should do anything about minimizing travel and so on, but the report from Europe was not very clear, and there was not much talk about an extensive spread at that time. Unfortunately, that was not the complete picture, and especially during the spring holiday for the Stockholm region, there was obviously a lot of spread out in Europe, and we got a lot of people coming back with the disease. But that part of the travel, especially to Italian Alps, was very well handled by the community disease officers in the different regions. And I think almost 400 cases were found. They were isolated and they were traced around them, and the normal cases basically were found. So we were feeling slightly optimistic at that stage. But just a couple of weeks later on, a lot more cases started to appear. And the whole strategy about contact tracing and so on was overburdened. So we went into a mitigation time from about the 11th of March onwards. And we decided early on that we would not go for a complete lockdown, but instead we would try to institute a mixture of legal measures and voluntary measures, because that's the way we normally handle community disease problems in Sweden. So we slowly introduced a number of different measures, mainly to keep the spread down, so not to have a health system that was overburdened or too much spread in the elderly population. And that has worked reasonably well. We have not had an overburdened health system. And there's been at least 20% of the ICU beds free at any given time. It's been a high burden on the system, but it has been able to handle it over time. The other part about protecting the elderly didn't work that well. We had quite an extensive spread into elderly homes, especially in the long-term care facilities, and that's where most of our fatality comes from. So that's where we are now, and what we're seeing right now is a stabilization in the country as a whole. In the Stockholm region, who's been worst hit, Stockholm and some of the surrounding regions, there is actually quite a clear trend downwards. We have an hour presently about 0.8, 0.9 somewhere. So we're seeing less and less cases every week, but it's not going very fast. In other parts of the country, the situation is stable. I mean, there's major parts of the country has not had very much spread at all. We see admissions to ICUs falling quicker than the cases in general, and we do see mortality going down, also reasonably fast, but still at the level of about 70 cases a day on the average. So the health system in Stockholm has stabilized, and they are now starting to provide a little bit more of the ordinary services. We have seen our yearly spread of flu and other viral diseases go down drastically. So the social distancing has had quite a lot of effect. And now we are trying to plan what we should do during the summer. What kind of measures do we need to keep in place? What can we maybe have a little bit less of? So that's where we are right now.
So what lessons have been learned? What would you do differently next time? And what should we think about as we're improving our preparedness for outbreaks and pandemics like this?
I think in Sweden we learned a few things that's really important for the future. One thing is the supply system for the healthcare system. We have constant new supply, and there's been basically no stocks of anything in place. And that proved really to be a big problem now when there was such a huge demand for any kind of equipment all over the world. And that's been discussed in Sweden for, I would say, decades, and there has been no solution to it, unfortunately. But I think after this, there really needs to be a solution. I think part of the reason behind this is the federal responsibility of this in Sweden, which means that even the really small regions with like 60,000 people would then have their own, and of course they have been hesitant to do that. But I think something needs to be put in place of this. So that's one thing. The other thing is the elderly homes, the long-term facilities, the quality and the way for them to keep measures and so on in place really needs a major overhaul. I mean, some of them are working really well, and some of them are excellent places. But once again, this was something we knew. I mean, the reviews of those facilities have shown that basic hygiene procedures and so on are definitely not in place in all of them. I think that's the other major thing that we really need to think more about. I think those are the two really big lessons, and I mean there's a number of other ones, but those are the really two big ones that we're going to take with us.
Okay. One last question, then we'll let you go. I know you've been very busy, and we're grateful for your time. I have seen estimates that possibly over 20% of the Swedish population has been exposed to the virus and may have some form of immunity. Could you comment on that? Is that correct? And what would the impact be on the prognosis for bringing this under control and returning to normalcy if that were the case?
We are performing a major serological testing with a sample from the whole Swedish population right now, and we will run them over the next couple of weeks, and then we'll know for sure. But there's been some smaller studies done in different contexts, the blood donors, hospitals, and so on, and we have done some modeling on that, and also on a PCR survey of also a sample of all the population. And all of those points in the same direction. There's even been 2 modeling being done showing the same thing, that we are over 20% by now, at least in the Stockholm central region. And we believe that this immunity we have in population in Stockholm right now is at least partly responsibility for the slowing down of the spread that we're seeing right now with an R0 or RE, which is definitely below 1. We hope that this increased immunity that we see every day, basically, towards the summer will really slow the virus spread down quite a lot. And that will make it much easier for the healthcare system, but also in the end make it possible for us to maybe slow down on some of the measures that we put in place.
Okay. Anders, thank you very much for making time for us. Look forward to continuing the dialogue and perhaps working together to tease out some more of the lessons learned for different aspects in the future. Please take good care of yourself. This is a marathon, not a sprint. Exactly. And stay in touch.
Yep. Thanks a lot. Bye-bye.
Bye-bye, Anders. Thank you guys for your patience with some of the technical difficulties. I can tell you it was a lot worse. Matt Tyler did his magic and put subtitles in some spots and really cleaned it up. Matt, thank you again for the good work there. There are a couple of questions. I think they were touched upon towards the end of Anders Tegnell's talk. There were some questions that were cut out. I asked him about the partial lockdown strategy, the decision not to close daycare centers and primary schools. Hopefully Fredrik can fill in some of those gaps as well, and also tell us a bit about the political administrative context around the COVID-19 public health response. Fredrik, the floor is yours.
Well, thank you. I think it's a good thing that you started with Anders Tegnell. He is sort of the face of this whole effort to deal with COVID-19 in Sweden. And he is that for many reasons. One of them is that he is really in charge of doing a lot of these things. I work for the cabinet office, and we are not interfering too much with this guy and his colleagues. And the reason for that is that Swedish agencies has a very strong position in the Swedish public administration system. The legal frameworks basically says that when it comes to disease control, it is their domain. If the government would like to interfere with this and overrule the Swedish Public Health Agency, they would have a lot of trouble doing so. I'm not saying it's impossible, but it would be very difficult. And just to give you a context, sort of a historical context on Swedish disease control, a lot of people who've been following policy in this area in Sweden are quite surprised that we are now the softies of Europe, that we are not, dealing with a lot more coercive measures than we are. One of the reasons, back in the old day when the HIV epidemic came around, Sweden had one of the most draconic set of measures to deal with this disease. And this became sort of a national trauma. The gay community in Sweden were not very happy with the way they were treated, and the different outlets that they had were closed down, and it was a pretty bad situation, and it caused a long debate about how disease control should be handled. And about 10, 12 years ago, they basically took the Center for Disease Control in Sweden and the Public Health Agency, and they merged it into one. And one of the sort of goals with doing this is that you would have a lot more sort of strategic, far-reaching strategies when it comes to disease control. And I think that worked. I think that the new agency has become a lot more, freer in their strategic work in terms of disease control. And we can see it during this, the pendulum has really swung a long way. And one of the sort of basic ideas that Anders Tegnell was talking about very early during the COVID-19 crisis was that in Sweden, we have seen great results from doing voluntary measures in public health generally. And one of the examples that he's been returning to is that we have a 98% coverage in vaccinations for a lot of the children's disease. So basically what they're saying is that we trust the Swedish public to do the right thing. The jury is still out on this. We see that we do have more mobility in our city centers than our Scandinavian neighbors. We do see some other, disturbing statistics, basically telling us that we're not locking down as much as everybody else. And we also, and I think if we can put on the next slide here, we can also see that deaths in Sweden has followed a pretty bad curve here. We're about the same as China until about 10 days ago. China is the long line going down to the right there all the way to the bottom. And you can see Sweden diverted from the Chinese line, which we thought would be a bad thing a month ago, which would now seem like a good thing. So we've been on a plateau here. And I think that Mr. Tegnell, he looks kind of worried that this is going on for too long. He was hoping that, we would be seeing the number of cases and number of deaths going down by now. So, the jury is out on a lot of different things when it comes to COVID-19, and we don't know what's going to happen. Will there be a second wave? This is one of the big issues. Even if we get new confirmed cases down, how do we prepare for, people going back to normal in too big of a fashion? So there are a lot of these issues being discussed right now. The other thing Tegnell said, and this has been sort of a guiding light for the Swedish strategy, is to keep the Swedish healthcare system afloat, so to speak. So basically, we've had, according to the public figures, around 20% of free space in our ICU departments. Now that is a national figure, and obviously the Stockholm area where I'm at and where we had the biggest outbreak, that's probably not true. I think that we've been very close to the limit during the past 3 or 4 weeks actually, but it now looks like we've weathered this storm at least. And one of the big issues now, and I think this is true for most places, is that there is such a huge backlog of healthcare that needs to be taken care of. And they're starting to try and sneak in some of the normal stuff that was postponed due to COVID-19. But, the big issue is staff handling this. Don't they need to, stop working 14-hour days and so forth, is one of the big issues. The other thing that Mr. Tegnell mentioned, and that is the big debate right now in Sweden, is how the disease came into elderly care nurseries here in Sweden. One of the early discussions was how we should stop that from happening, how these places should really, be careful, look over their procedures, but none of that helped. And it looks like somewhere around 65-70% of the nurseries in the hardest hit areas have actually seen cases of COVID-19. So that's the government actually just apologized for this, which I think is a pretty big thing in our system to go out and do that this early in the chain of events. So just maybe a few words on where the government stands right now in its work to contain this disease and basically keep the economy afloat. We've actually had 5 new national budgets since COVID-19 first hit in Sweden. And just as in the US, these are huge financial packages, basically to avoid bankruptcies across a lot of different sectors of our economy. It's not fully going to work. We're seeing bankruptcies right and left right now, and obviously, hotels, restaurants, all these sectors are really, they're not going to be the same once this is over. One of our biggest problems right now, and this is something that the government is working really hard and putting a lot of emphasis on, is that we are a very export oriented economy. So most of our, big chunk of our GDP are big companies, auto manufacturers, high-tech companies, telecoms, and they are extremely dependent on their value chains working. And right now, there are so many problems. And we're seeing Gothenburg Harbor, which is our biggest commercial harbor, is down 40% in cargo. And there are all these sort of cascading effects that especially affects these large companies. And they, in turn, then affect the local communities and businesses that really survive by providing these companies with parts and so forth. So that's one of the big issues right now. How do we keep these companies afloat? They're almost too big. They're too big to fail, but they're also too big for the Swedish government by itself to just hold under the arms for a very long period of time. So there are a number of these issues that are really difficult, and obviously the government is opening up its coffers, but we'll see how effective they can be about dealing with that. So I think we have one more slide here. We can take a quick look at that. This is confirmed daily deaths. One thing I like, if you can like something about anything when it comes to this kind of statistics, is that it predicts the lag of reporting in deaths. So if you see the light gray bars at the right, that is basically what we think is going to happen in our reported deaths over the next when more reports come in. So it looks to me like we are plateauing at a pretty high level, and this is something that is raising a lot of concern. We would hope to be going to a better and lower level by now. So I think that's pretty much it, and I'm open to answer any question.
Thank you so much. Just a quick question: if the level does plateau at a higher rate than what was hoped by for officials, do you think there'll be a change in policy, or will it be just stay the course?
There's a lot of this is my very personal view. There's a lot of political capital invested in this strategy of not sort of going all the way with the lockdown. And one of the reasons that has been given all the time is that this is a much more sustainable way of doing it. We're going to be facing a second wave this fall, very likely. And if we are going to be able to combat that, doing it this way will make sure, or at least make likely, that people will behave in accordance with guidelines. So this is something that Anders Tegnell has been, singing the gospel of for a long time. And I don't see the government overruling him on that. And it would have to be pretty bad, I think, for more measures to come along. I do think that the one thing that might change the strategy, if we see that, people stop following the recommendations of the agency, that would be the one thing. If it's really overtly ignoring recommendations, that might be the thing that could cause a change of track.
And a final, before I get to other questions, and again, anyone who's on, please remember you can put your questions and answers into the Zoom bar and where it says Q&A. A final question, and we are seeing, we're seeing a lot of people actually that are not following the direction of officials and following even basic guidelines. Do you see any of that type of pressure? And if not, can you talk just a little bit about why you believe that's the case in Sweden?
I think that, from whatever statistics and numbers we have, we're seeing that, all in all, behavior seems to be pretty much in line with recommendations. Obviously, every time the weather's nice, all the journalists run out downtown and take pictures of people sitting in cafes because most of the cafes are open. But all in all, I would say we've seen mobility in our city centers go down a lot, not as much as in Oslo or Helsinki, but pretty close. And so I do think that it's also become sort of because Sweden has been really standing out in international media on this, it's become sort of national pride that, let's make this work. And I think you shouldn't neglect that factor as well, because it's now become an issue. So we have a more open strategy about how we deal with restrictions. Now let's make this work. Let's make the more democratic, open strategy something that might work. And, I do think that a lot of people take that seriously. Not everybody. And we do see places, and the police force in Stockholm, for example, have been reporting places that are, out of control in this measure. But it's marginal enough that I don't think we'll have to do anything major about that strategy because of it.
Great, thank you so much. As always, we would like to go to your questions and answers, and it's my pleasure to introduce Vice Dean Mary Gallant from the School of Public Health, and of course the Vice Dean from the School of Preparedness, Dr. Jennifer Gall. Jen, do you want to give us a few questions?
Sure.
And do me a favor, everybody. Typically, before you start, a lot of you wait till like 7:56 before you put your questions in. So if you could put your questions in now, that would be really great, because Fredrik needs to get to bed because he's got a call with Australia in just a few hours. So go ahead, Jen.
Although Sweden has stated that achieving herd immunity is not its stated aim, is there a belief that Sweden will nonetheless be ahead of the curve in this respect through more pervasive exposure?
I think there is. And I do think that early comments from Anders Tegnell and some of his colleagues a little bit alluded to that herd immunity is a possibility, but they also said that we don't know enough about immunity against COVID-19 to have that as a strategy. Now, there's been a lot of talk about this, and people are trying to ask gotcha questions from Anders and his colleagues. But I do think, and there are now studies in Sweden saying that herd immunity will, be a factor long before 80%, what would be the more traditional measure. As early as 40% immunity would start slowing the spread. And if that's true, which we don't know yet, but there are early studies that show this, then obviously that might affect how a second wave would play out and so forth. So I do think that it's a factor. I don't think it's sort of the end goal of what they're trying to do.
Thank you.
Another question?
Yep.
Dr. Goodall?
Given the number of deaths in elderly homes, what is Sweden doing now to better protect its elderly population?
I think this is the big issue right now, because we see things in our elderly homes that we haven't, really cared about enough, like how extremely low pay some of the workers in this industry has. We recently privatized this sector, and that has not meant good things for the people working there. And there's a number of these issues: the low level of education, it's impossible to isolate the different units of some of the bigger elderly homes in Sweden because of the way they are planned. And there's a number of these issues. They were also robbed of whatever personal protective equipment they had early on because they went to the major hospitals. So there's a big number of issues, and there's a lot of blame to go around. And I'm sure this is going to be one of the thorniest and most blame-ridden issues after everything is said and done here. But having said that, there are now investments going on, but they're not going to fix all these problems in 6 months or whatever. You would have to if there is another outbreak this fall, I'm afraid we're going to see a similar trajectory of the curve even then.
Thank you. Do you feel the general public is in fear of getting the virus? How much media coverage is devoted to COVID-19 versus other news?
I think it's the same as in other places in terms of media coverage. It's huge, obviously, both the financial side of this, but also the disease control side. I have seen figures showing that in Sweden, the fear is lower than in many other countries. I do think that part of the reason for that is the guy you saw on a shaky link from a train, because he has become sort of the voice of public Sweden, and he seems very reassuring to a lot of people. And if he says, we're doing okay, and our healthcare system is hanging in there, people tend to believe him. So he's a big part of actually calming some of the fears out there.
Great, thank you. Can you talk about how you think this pandemic and the lessons learned will change the way countries work together to address global health security challenges in the future?
I think the early months of this pandemic has been very disappointing in terms of solidarity, in terms of how we cooperate around these issues. I do think there are some bright moments that have come up recently. For us, the European Union would be sort of the go-to multilateral organization, and they performed really, really badly in the beginning, where people, put in export controls on some of the most needed items in dealing with COVID-19. Recently, there are good signs that we have cooperation that is coming out of this, although I'm not super optimistic that, the EU will play a huge role down the road even. Although I do think that some of the institutional issues that has to do with public health might be sort of institutionally strengthened as a result of this. The WHO is also in bad shape. The funding issue with the Trump administration, I think all this is pretty disappointing, and there needs to be more discussion going on and how we can strengthen this. So I'm not very optimistic. I do think that we have a chance if we look away for a second from public health and more into the economic side, that there will be more cooperation down the road, but we haven't seen it yet, and we could just hope.
Thank you.
Dr. Go, before you ask the next question, if I could just jump in, do you believe that the sort of stumbles by the EU at the beginning of the pandemic will have a lasting impact on the makeup of the EU? Do you think it would lead to more Brexit type discussions in other countries, or do you think it's something that is stabilized?
I think it could be bad news for Brussels. We do see, because it's not only this, it's not only the acute response to the health crisis, it's also about how, you know, Italy and some other Southern European countries now want Corona bonds. They want basically to Germany to sign their loans. And Germany is not going to do that. So we have this old rift between the North and the South in EU, made even worse by sort of the presence now of the East of EU. And this rift is not looking very promising. And I think over the next 2 months, the EU has to get its act together, because this is going to leave a lasting mark on the Union if they don't do something pretty drastic and you know, get their act together pretty soon.
Yeah, thank you. That's particularly scary given Russian actions with the EU. Dr. Goodall, the next question.
Sure. If you would have started this all over again, God forbid, do you think Sweden would have chosen the same approach?
It's a good question. Frankly, yes. I think that the approach that we took, and this is coming from Tegnell again and his colleagues, basically there was a consensus in Scandinavian and Northern European public health agencies that this is probably the best approach. But in other countries, politics came in, and there was a rush to really get the lockdown measures in. And so at least this is the Swedish story, for what it's worth. Here in Sweden, because of the extremely strong position of the public health agency, this sort of expert-driven method of trying to do it prevailed. And I think it would prevail again. And I think if we see a second wave, I hope not, but if we see it this fall, I think we're going to go back to the same measures with some, you know, changes because of what we learned during this first time around.
Thank you. How is Sweden working to mitigate the effects on migrant communities which have been hit disproportionately hard?
That is true. When the first cases came in Sweden, the hardest hit community was a community with a lot of migrant inhabitants in the west of Stockholm. And that became sort of a policy issue. Not everything is known about this situation, but there was an option raised that you could actually quarantine this neighborhood. So that was an option that somebody put on the table. And it became a big issue in policy circles. If we would do this, we would lose credibility with some of these populations for a very, very long time. And we have a history of riots in some of these neighborhoods and so forth. So that option was taken off the table. So that's one part of this problem. And the other one is, it is a big debate in Sweden now. So why is it that these communities were harder hit than almost everybody else? And, you know, I don't have any real scientific studies on this. There's a lot of, you know, guesses on why this might be. In the particular outbreak that I'm talking about, there was a big religious festivity that preceded the outbreak. So the easy answer is that particular event probably had something to do with it. There's also talk about, you know, languages to give agency information. Was it done good enough? And was it worded in a way that could make sense and travel culturally? And these are all issues that are being discussed right now, and I don't have any clearer answers than that.
We still have more questions. Is it okay to keep going, or do you need to go?
Yeah.
Okay, great, thank you. What would your recommendation be for New York in order to open our communities moving forward?
I think that one of the things you have to think about is that once you start easing restrictions, how to make sure that, you know, the pendulum doesn't swing all the way. How do we keep some measures in place? How do we keep, for us, the big issue is there can be no more than 50 people. And we're probably going to see that restriction in place until, you know, we have a vaccine or herd immunity or whatever. And I think the issue is, how can we let go of some of the harshest restrictions while telling people that you really, really need to abide by the rest of them? And that's public communication, that's risk communication. It takes a lot, I think. You seem to have some TV stars as well doing pretty well at this. So, you know, I think it has to be a communicative strategy as much as one that has to do with epidemiological modeling and whatever. That's my, you know, only answer I can come up with.
Great, thank you. Last question, I think. Can you please talk about specific drugs that are used in Sweden to treat COVID patients? Is there anything done differently than in other countries and the US specifically?
I am not an expert here. I know that the malaria or Ebola medicine with a difficult name, hydroxychloroquine or something like that, has been used. There's a Swedish study for using this on COVID-19 patients. It's not positive at all. Apart from that, I know that one of the things that has been a problem here is an anesthetic medicine that is used when you put people in ICU units that has been lacking. And they're now even using the veterinary version of this drug. So there are shortages that has been problematic for Swedish healthcare. Apart from that, I don't think that we're doing stuff very differently from everybody else. One thing that I just heard and that they're now doing a major study on, that is more of an anecdote, it seems to me, than anything else, is that they're starting to put nicotine patches on healthcare staff, because there are something about the receptors that, you know, the virus attached to, that are being affected by nicotine, because they see that smokers are less affected by COVID-19 virus than other people. But, you know, I'm no medical expert, and I just found that intriguing, if you will. But I don't know anything more about that.
Great, well, thank you. That is all the questions we have. So Dr. Stern, I'm going to pass it back to you.
Thank you.
There we go. I take the opportunity to make a couple of comments and then maybe ask Fredrik another question or two. So Sweden has done better than some countries and worse than others thus far, although I do think Anders Tegnell and the proponents of the Swedish strategy see it as an investment. They're taking the pain early, and hopefully that will put them in a position where population immunity may put them in a better position later. What are some of the aspects of Sweden that have enabled Sweden to do as well as they had, when some outside critics were saying this is just going to be, you know, a total disaster compared to other countries? So one, I think, and Fredrik, please feel free to comment on any or all of these. One aspect is that Sweden has a lot of built-in social distance. It's not a touchy-feely, huggy culture. People tend to give each other a lot of personal space. It's not the kisses on 3 cheeks like they do in Italy or France or Spain. So I think that was one aspect. Another aspect that's discussed is the demographics. A lot of single-person households. I think it's the highest number of single person households in the world. So people already are distancing, not having big multi-generational families like in Italy. That may also be a factor. And then the trust. It was mentioned that the authorities trust the people to follow recommendations, and the confidence in the public health authorities is pretty striking. What is it, Fredrik? 70, 80%, somewhere along the lines, are positive to the response, have confidence that this is the right path, and that's a good thing in many ways. One question that has come up, some Swedish researchers who question the approach have published op-eds, and large numbers of them have signed it, where they feel like it's very difficult to question the strategy. In America, we question absolutely everything, and there's just a rough and tumble debate about all of this. Whereas in Sweden, it's a consensus culture, and seems to be a lot of normative pressure to rally around the strategy, which Fredrik has pointed out has become a point of pride. That's a good thing in some ways, and it makes the government's job easier in the short term. Is there a danger of that turning into groupthink? And then one more question. You mentioned Anders really being a national icon and treasure, and just having connected with people. What is the secret of his success? You're an expert on crisis communication. How is he doing it? Because it's remarkable.
I agree. I think one of the reasons, people are worried, and here's a guy, he has no media training, or if he has any, it didn't rub off. So basically he tells journalists off, he gets mad at press conferences. There's this German guy who is at every press conference asking questions for German media, and they always get into fights. It's really entertaining. So I think that's part of it. His complete lack of pretense. He's just doing his thing. He's this gruff bureaucrat who is telling people like it is. And for some reason, that's reassuring to Swedes. I don't know why. The other thing you asked about is that the debate climate has been, I think there's something to it. We had this, they're called in public debate now, they're called the 22 scientists who protested against the strategy of the Public Health Agency. And they've been through a pretty rough and tumble couple of weeks because people are now looking at their modeling. I think the most famous, alternative epidemiologic modeling that one of them had been developing said that by now Sweden would have, 20,000 deaths or something like that. So people have been hitting them really hard. And it's also, we talked about how there's national pride seeping into, having this strategy, and these people are, taking heat for not getting behind this thing. And I do think there's something to it. And Sweden is a small country, and you don't, mess with our rally around the flag effect, if you will. So yeah, definitely. Could there be groupthink there? I think there could. I do. I'm involved in how the discussion goes in the government offices. And one of the things, if we were to really part way with the way the Public Health Agency are doing things, we would be in some serious trouble, because that would be a big fight, and we don't know we would win. And I think that says a lot. The other thing, how is it that this strategy could more or less work? I think all of the factors that you mentioned, Eric, are important. I also think that, the public health situation to begin with is important. I think that Swedes are less obese than most people in the world, lower diabetes. We have the lowest, I think, portion of the people smoking of any country in the world. So there are a number of these risk behaviors and risk factors that probably told these people that, you know, we're going to be hit less harshly than other countries at least. And then depending on how bad this virus, that may not help. But I think that's one of the reasons why they would go for this strategy.
Thank you, Fredrik. Great answers. We're almost out of time. I don't know if there are any other questions from the audience or the other panelists. But I'll turn it back to Dean Griffin.
Thank you so much. And Fredrik, thank you so much for it's almost 2 o'clock in the morning, and we really appreciate you being here. And maybe there's an opportunity when the university is taking the lead, and the president is the lead researcher on a health disparities study in New York. And it sounds like there's some potential research that could be interesting to look at the work that you're doing as well. And as always, we just want to thank you for your partnership and your willingness to work with us. Dr. Stern, again, thank you for organizing this wonderful session. As I said at the beginning of the session, that our esports team was at play tonight in the Chancellor's Cup, and I'd like to announce that our Rocket League beat the University of Buffalo, and we are going to the semifinals. So congratulations to the esports team and the Rocket League team. We really appreciate that. And just a couple of quick messages. Again, check our social media, CEHC and School of Public Health. We don't know where the future is going to lie, but anytime that we can try to bring you the type of speakers that we have seen in this town hall series, and anytime that we can bring a community together to ask the type of questions that you have, it is absolutely well worth its time, and it's part of what makes the University of Albany so special. As I say, thank you and be safe on behalf of President Rodriguez and Provost Kim. I would just like to leave with this thought. Please remember to hate the virus and love the people, and don't fall into the trap of thinking that the virus is that there's immunity for one type of people or another. It's affecting everybody across the globe. So be safe. For those of you that are students, best of luck with your finals. And for those of you that are graduating, congratulations, particularly Matt Tyler. On behalf of Vice Dean Gallant and Vice Dean Goodall, and certainly our own Dean Holtgrave, who's on CNN, I'm Dean Griffin, and I want to thank you very much for being with us. Good night, everybody, and be safe.